Welcome to Gastrostomy and Gastrostomy Jejunostomy Tube Care, keeping your patient's feeding tube safe. What is the difference between a G tube and a GJ tube? A G tube is a tube placed in the patient's stomach for feeding, medication, or venting. A GJ tube is a tube placed in the patient's stomach and small intestines. The G portion is placed in the stomach, typically used for venting or medication, and the J portion is placed in the patient's small intestine for feeding. What do you need to know about your patient's feeding tube? You need to know the brand, the size, measured in French, the length, the type, the balloon size for G tubes, how many milliliters are needed to inflate the balloon, and the name of the physician responsible for the feeding tube. What should your G tube and GJ tube look like? The site should be clean and dry. There should be no redness, leaking, foul odor, pain, or excessive tissue growth, a granuloma. Both should flush well. Keeping your G tube and GJ tube safe and secure. Keep the tube secure beneath your patient's clothing and do not allow it to be pulled out, either by your patient or by the tubing getting caught. Secure the extension set during feedings, as if it gets pulled, the entire tube can become dislodged. Remove the extension set when feedings are not being given to decrease the chance of being pulled out. If a G tube or GJ tube becomes dislodged, a new tube must be placed within 1 to 4 hours, as the stoma can close very quickly. Nurses should replace the G tube immediately if they have been trained to do so if it becomes dislodged. You do this unless it is a newly placed G tube. A newly placed G tube needs time, at least 8 weeks, for the gastrocutaneous tract to develop, and a physician must be notified. Nurses should advise the patient's family to go to the ER or doctor's office immediately to replace a GJ tube. Keeping your patient's feeding tube clean. Wash your hands with soap and water prior to touching your G tube or GJ tube. Wash the site with warm soapy water or half-strength hydrogen peroxide daily and as needed. Dry the area thoroughly after washing it or if it's wet. Assess the site daily or more often with changes. If a gauze or a dressing is on, change it daily or more often as needed. Troubleshooting G-tube and GJ tube problems. Number 1, a leaking G-tube or GJ tube, or if the G-tube or GJ tube feels loose. Solution: check the water level in the balloon. Report any leaking to the physician. Number 2, the feeding tube won't flush. Solution: attempt to flush slowly with 5 to 10 mL of warm water. Do not force. Use a push-pull method to see if you can dislodge the clog. Flush as ordered throughout the day and night to avoid clogging. 3, skin surrounding the stoma appears infected or granulation tissue is noted. Solution: contact the physician if stoma appears infected or if you see granulation tissue. Every patient with the feeding tube is unique and may have unique challenges. G-tubes and GJ tubes bring a patient's nutrition directly in the stomach or small intestines. The feedings and maintenance of these tubes need special care and attention. Normal activities do not need to be stopped just because a patient has a feeding tube. Follow doctor's orders for your patient, as each patient is unique.